right? So we went over the electrophysiology of those two cells, right? So those are the cells, right? So what is happening in individual cells. Okay? So today we're going to put all of them together, like heart as a whole, and see what is happening in the heart. Okay? So this I've already done, so I'm just going to quickly go through. So a quick recap. So you should know how to answer this question, right? So you need to mention the deep pacemaker potential, depolarization, repolarization, hyperpolarization that leads to the pacemaker potential, right? And hyperpolarization is what leads to the unstable membrane potential, right? So in this question, I am expecting you to do the 4 phases and also talk about pacemaker potential and unstable membrane potential. So unstable membrane potential, pacemaker potential, and hyperpolarization. I need to see those 3 terms explained. Okay, so that is what it is. And then you have this one, contractile cells, where explain like the entry of the positive ions, right, the cations into contractile cells, starts the depolarization, right, of sodium gates with the help of sodium, then the plateau, right, so you're talking about inward flow of calcium, outward flow of potassium. The longer the plateau, the longer the contraction, and we'll come to that. And then you have the repolarization. So at least 3 steps is from this one. All right? So you don't mix them together. They're completely 2 different types of cells. Okay, so explain it. All right. And I'm going to explain this one, and we'll talk more about this. I'll be back in just a minute. Let me go to the restroom. So when you open up, so have these open because I'm going to close this down and I'm going to draw everything out on the board. All right, so have those PowerPoints open up.
You know Nelly, one of her husband, so she can't come and then she's asking if someone can report her.
Really?
Yeah. And I don't report because I don't have space, but
I can send it in the group chat and then you can share it with her.
okay. Through text,
The group meet thing?
and then I'll send her through her. Should be able to download it once I do.
Yeah. I think so.
She went to the bathroom. Oh yeah.
But she shared the slides of the flashcards with me, and she said they're pretty accurate to the exam. One of my friends, she's a tutor and she took this class, and she said she made flashcards every test, and she said they're really accurate to the test.
Those flashcards? No.
59.
She remembers.
I
Like
think
after the test.
she's a tutor for anatomy.
Who have you shared?
And then I also I have these
I'm not gonna.
with everything that we've done so far.
I went the wrong class. I'm sorry. I was about to leave. So let me close this. All right. Okay. So we have the individual cells, right? What is happening in the individual cells? Now we're going to go into what happens in the heart as a whole. So I'm going to go over different things first and then put them all together. Right? So let's talk about EKG. Did I talk about EKG last class?
Nope.
Not really. Right. So EKG is the electrical activity in the heart. Okay, so don't get confused between what we just did contractile cells and autorhythmic cells, that was individual cells, right? So what was the electrical activity in individual cells? And EKG or ECG is the electrical activity in the heart. Alright, so the whole heart. So we have three waves. Okay. And this is called P, this is Q, R, S, and T waves. Okay? So the P wave indicates atrial depolarization. And then QRS is ventricular depolarization. And also atrial repolarization. And we have T wave, which is ventricular repolarization. Okay. So what this means is, so we have the heart, okay? We have the SA node, AV node, bundle branches, and Purkinje fibers, right? These are called the nodal cells, right? So we have SA node, AV node, bundle branches, and Purkinje fibers. Okay? These constitute are they the contractile cells or the autorhythmic cells? Autorhythmic cells. What percentage of the heart are these cells?
1%.
1%, right? So that 1% is in SA node, AV node, bundle branches, and Purkinje fibers, right? They don't contract. Their job is just to set that rhythm, right? That auto rhythm that the heart wants. SA node is the pacemaker of the heart, right? So this beats about 72 beats per minute, and this the depolarized wave goes all over both the atria through gap junctions, right? So these are called as internodal pathways. They're not nodal cells, but they're going through the contractile cells, through the gap junctions. It's almost like a domino effect, right? So you have positive ions going from cell to cell to cell to cell. Here, this is completely insulated. No gap junctions between atria and ventricle, right? The only connection, only electrical connection is the AV node. That's it. If this stops working, the electrical activity is not going to pass through. Okay? That is called as heart block. Okay? So these two are really important. This one because it sets the pace for the heart, and this one because it is connected to the ventricles. Okay? Alright? Any questions so far? Any questions? Okay, so we are just talking about the nodal cells, right? So we bent over each cell will have that pacemaker potential, the depolarization, repolarization, hyperpolarization. Each cell is going to have, right? This is going to have 72 times per minute. This may have for 45 times a minute. And as we go down, it goes lower and lower and lower, right? And that's why we need this to set the pace, okay? Now, these cells here, the internodal cells, they are very small diameter, so it's a little slower than the electrical activity as it goes here, right? The ions are going to move faster here because you have the cells which are much larger with larger diameter, right? So depolarization, repolarization of ventricles happens much faster than de and repolarization of the atria. Okay? Yeah. Why is AV important? AV node?
Because it controls the ventricles.
Because it is connecting the ventricles to the atrium, right? So this is the only connection for SA node to innervate the ventricles. Good. So this is really important. Why is SA node important?
It sets the pace for
That
the
sets
arm.
the pace. Right. What is the pace?
70
About
to
72
72.
beats per minute. Right. 70 to 75 is the pace. All right. So this is like, I'll come back to this. Okay. So we have depolarization in general, which is followed by contraction. So I'm writing it in another contraction. And then we have repolarization followed by relaxation. Okay? These two are mechanical events, these two are electrical events. Okay? So I'm going to go back to the skeletal muscle in just a minute. So if you remember from skeletal muscle, we have the axon terminal, right? And we have the muscle, skeletal muscle. We had the depolarization, depolarized wave coming here, message going here, and then we had the depolarized wave going down the T tubules. Remember that? Right? And then that led to the release of calcium and attachment of myosin head to the actin molecule, right? So that is what is causing the contraction, right? So this is the depolarized wave, right? That leads to contraction. So there's a little gap in time. I'm talking about milliseconds, right? So the contraction follows the depolarization, right? So you have the depolarization taking place, and then you have the contraction taking place, right? And then while this is happening, then you have the repolarization, like closing of the sodium gates, and you have the repolarization, and then it relaxes, right? So here, for the cardiac muscle, we have the same thing. So we have this depolarized, right? So the atria are depolarized, and then they are going to contract, okay? And once the blood flows here, then they will repolarize, and after repolarization, they're going to relax, right? So we have depolarization followed by contraction, repolarization followed by relaxation. Okay, so it is in that sequence. Any questions? And please pay attention. I don't know what you guys are doing. Pay attention to this. Questions? If you have questions, please ask. This is a difficult concept to understand, right? So we're talking about two different things. Yes.
From on the downwards from the P to the Q wave, as soon as it starts going back up, is that when the valves close and it contracts?
So we are not talking about mechanical events,
Okay.
right? So this is just electrical activity, right? So when we talk about EKG, we are talking only about electrical activity, right? Closing of the valves, contraction, flow of blood, those are all mechanical events. It's going to cause it, but it's not the same.
So that's what I was asking. Like, is that because I was reading something in the textbook when they depolarize, that's when they, or sorry, repolarize, that's when they close again, right?
We're not talking about that.
At all. Okay.
Not now,
Okay.
right? That's where I'm coming at.
Okay.
So, so we are going to put all of them together,
Mhm.
but first let's understand separately.
Okay.
Okay? So these are electrical events, right? What are electrical events? That is depolarization, repolarization, depolarization, repolarization, right? So when first the atria are going to depolarize, the depolarized wave comes to the AV valve, then the ventricles are going to depolarize, that's the QRS, right? While this is depolarizing, this is repolarizing, right? That's why we have this big wave, right? And then you have the T wave that atria relaxes, once it's relaxed, right? Then we talk about ventricular depolarization followed by ventricular repolarization, right? So you just need to know what is happening in P wave, what is happening in QRS, and what is happening in T wave, right? That is your EKG, okay? EKG is the mapping of your electrical activity of the heart, right? Is that clear? All right, it's the whole heart, right? When we were talking about the contractile cell, we were talking about the autorhythmic cell, we're talking about one cell. Okay, so don't get confused between the two. Yes? Okay. So,
When the SA node is traveling down the atria, how does contraction happen in the SA node?
we're not talking about contraction yet. Let's not think about contraction. So, write down the SA node, nodes, that is your electrical activity, right? So that is your depolarization and repolarization. Contraction, relaxation, these are mechanical events. It's going to cause it, but we'll talk about that. Okay. Question, Jimena? No, okay. We good? We good so far? Okay. I'll ask you to ask that question after I'm done with this, okay? And then we go revisit that. Okay. So, SA node fires, depolarizes the atria, it reaches AV node, right? And then boom, it goes and depolarizes the ventricles. It's almost like you're coming from 288 south, right? You're coming up north. You have like 6 lanes, right? All the cars come, and then you have to stand in that parking lot, really, right? On that 45, just one lane, right? All the cars come, stop, and then boom, it opens up in 45, right? Something like that. So you have all this depolarized wave coming, stopping, and then boom, it goes, okay? Going here is very fast because of the size of these cells. These cells are pretty big. All right, now why? Why do we need that AV, a stoppage at AV? Okay, let's talk about that. So this is clear? EKG is clear? Okay. Now, what significance does it have? Once the cells get depolarized, okay, what's going to happen next? So inside the cells, now you have all that positive ions. I'm talking about the contractile cells, right? So we have the depolarization, right? So the positive ions are going from cell to cell. That triggers open, right, the voltage gates of sodium. Sodium comes in, depolarizes, sodium gets closed, calcium comes in, potassium goes out, right? That's your plateau, and then you have repolarization, right? So this is for the contractile cells. Now, what do contractile cells have? Contractile cells. What do contractile cells have inside the cells? The A band and the I bands, right? So when we are talking about the depolarization, what's coming in?
Calcium.
What's coming in here?
Sodium. Sodium.
Right? What's coming in here?
Calcium.
Calcium. So this calcium, about 20% of calcium comes in, and you have sarcoplasmic reticulum, okay? This is going to open up the gates for the sarcoplasmic reticulum for calcium to come out, right? When calcium comes here, it's going to attach to the troponin, right? Which is going to move the tropomyosin, and you have the attachment, right? So you have that contraction taking place. So this is what I'm talking about, that depolarization is followed by contraction, right? And then once it gets repolarized, it's going to let go, right? So that will lead to relaxation. Is that clear, right? So contraction and relaxation are mechanical events. They're not electrical events, but the electrical events are causing the mechanical events. Does that answer your question?
Yeah.
Kind of, yeah. And we'll come to the other question, opening and closing of the valves. I'll talk about that. So if I remove this, just visualize it. So depolarization causes contraction, and repolarization is followed by relaxation. So if this is contraction, this is relaxation, right? So in cardiac muscle, you have one contraction and one relaxation, all right? So this thing somewhere here, atria is going to contract. Does that make sense? Right? So, and here, we are talking, and by this time, atria are going to start repolarizing, so they will relax, we don't care about that. And then you have, this is also indicative of ventricular depolarization. Once ventricles depolarize, somewhere here, what is going to happen? Ventricles are going to contract, right? So after following this, then they contract. Klaus, you had a question?
No, you answered it right.
Yeah.
Yeah.
Yeah, okay. So two separate events, right? So you have an electrical event followed by a mechanical event. So here, so you also have the blood flowing in, right, on both sides, right? And you have the valves here. These valves are attached to, what are they attached to? The chordal tendinae is attached to
Papillary
the
muscles.
papillary muscles, right? So here is the papillary muscles. So depolarization, then depolarization, repolarization, followed by repolarization, okay? Depolarization, repolarization, ventricular depolarization, followed by ventricular repolarization. Atrial depolarization, followed by atrial contraction, right? Ventricular depolarization, followed by ventricular contraction. Got it? Okay. So, eosinophilus depolarizes the atria, reaches here at the AD node, okay? Atria contract. Alright? By that time, this has left the AV node, the ventricles are depolarized. Before the whole ventricles depolarize, before here, you have the papillary muscles which are depolarized, right? So before the whole ventricles depolarize, these muscles get depolarized. If these muscles get depolarized, what are they going to do? They're going to contract, right? When they contract, they are going to pull, or this also, so this is shortening, so that is going to close the valve. Alright, so once the valve, so blood has flown through, the valves are closed, right? And then the ventricles start to contract, okay? When the ventricles contract, they're going to push open the semilunar valves and the blood flows out. Okay? I'll repeat it again, okay? For now, just understand that depolarization is followed by contraction, repolarization followed by relaxation. Atrial depolarization followed by atrial contraction. Then you have ventricular depolarization and atrial repolarization taking place at the same time. That's your QRS, right? So atria, we don't care now anymore. Atria is going to relax. Now the ventricles are going to contract. Before the ventricles contract, you don't want the blood to go back into atria, so the valves have to close, right? So they close because of the papillary muscles. So papillary muscles are going to contract, close the valves, the ventricles are going to contract, and then push the blood out through the semilunar valves. Question? Anybody? Klaus, ask me questions now.
No, the only question I had earlier actually was, I actually just wanted to know, or clarify for myself, that at the same time at the Q, like the turning from Q to R, down, to the left,
Oh,
right there, I just wanted to know at the same time, when that was happening, at the same time the contraction was happening.
so, yes, this is where the contraction is happening, because it's already depolarized.
Yeah.
Right?
For the
So
atria?
for the atria.
Okay.
So this is atria, depolarized,
Mhm.
right? So atria has to depolarize, then it contracts. Ventricles have to depolarize, and then it contracts.
So the atria are contraction, the contraction at the Q, and then the ventricles are contraction at the S.
And we don't put it on here because it's an electrical activity. But you can mention, okay.
Mm.
What happens if it's, what happens if the electrical signal isn't, strong enough? If it won't contract and it'll mess up the.
Then it's going to mess up, so we'll talk about that, good. So that clear, right? So we have electrical activity and we have mechanical activity. Alright, so let me erase this. Okay, and the closing of the valves are called as lub, dub, closing of AV valves, and closing of semi-lunar valves. Blood always flows from high pressure
To pressure.
to low pressure, always. Okay, so blood flow. Okay, the right side is always low pressure. Left side is higher pressure. Okay, on the right side, the pulmonary artery has 24/8 mmHg. On the left side, aorta has 120/80 mmHg. So when we are talking about high-low pressure, we are talking about the movement of blood. Volume of the blood remains the same in both sides. Contraction is called as systole. And relaxation is called as diastole.
What was the right and left? What was that? What were you talking about?
The volume,
Yeah, like,
like amount of blood that comes on both sides is the same, but the pressure is different.
the right side is lower pressure
Yes,
and
right.
So
Is-
you low pressure, not volume.
Pressure, volume.
Oh.
What's here?
Pulmonary artery. Inside.
You mean right and left side of the heart, right? Or, sorry.
Left side of the heart goes to pulmonary artery. And, I'm sorry, right side goes to pulmonary
Yeah.
artery, left side goes to the aorta.
And it's low pressure because the walls are thinner, right? Does that, does that
That's
do
why
with
the
it?
walls are so thin.
Oh,
on the
okay.
right side.
So do you remember when she?
But are the walls thin because of the
No.
pressure? Like, is that the body making up
When
the
she
pressure,
cut
or
one,
is it
it's
so,
one.
or is that so it's low pressure?
It is made that way because we
Because
don't
the
want
body
high
part.
pressure on the right side.
It's in that one picture
Because
that she
you're
put in
pushing
her
into the
notes, so it's
lungs.
like cut
Right, so you
halfway,
don't need
right?
that much pressure, whereas the left side is really muscular because it needs that high pressure.
Because it's the whole body.
Volume is the same.
what was the unit?
Oh, that makes sense.
Because it's pushing out farther
Volume
than
is meaning
pushing to the lungs, which is just shorter.
But that's pressure. What you have listed here is pressure.
This is pressure.
mmHg.
mmHg, millimeters, Hg means mercury. Mercury. So that's a unit, mmHg. And we're talking about EKG, right? So let's finish EKG and then I'm going to talk about this. but it's the whole heart, right? So we have the first wave, that's called P wave, then you have QRS, okay, and then T wave. P wave indicates atrial depolarization. QRS represents ventricular depolarization
Also
and
atrial
atrial,
Repolarization.
and T wave is
ventricular
ventricular repolarization.
Repolarization.
Contraction follows, right, contraction follows the depolarization.
Repolarization.
Contraction follows the depolarization.
Repolarization.
Okay? And they relax, so here atria is relaxed, and atria is going to relax after here, right? So this period is when the heart is in relaxing, right? This is when the blood is flowing through the body, and then the whole thing starts again. Okay? This is called quiescent period. So this is happening like in milliseconds, 0.8 seconds, right? And you can count these R waves and you can calculate the heartbeat. Okay, so you have number of these R waves times something. There's a formula for that, right? So that will give you the idea of how many beats are taking place. Okay? If the beats are slower than what it should be, that is called as bradycardia.
Bradycardia.
Yeah. So if the heart rate is less than 60 beats per minute, that's called bradycardia. If it is more than 100 beats per minute, that's called tachycardia. Bradycardia is pretty common. It's good to have bradycardia where you have less signals, right? So less depolarization, so that gives it time to contract more. Anyway, we'll come to that. So these are the two terms that we are going to look at. And I don't worry about the signal segments and the intervals, so don't worry about that. But we will go into the different elements. So in this one, what is missing?
T waves.
Is T missing? I can see the T's.
Right here.
T is here. What's missing? After every cycle, so P, Q, R, S, T. P, what's missing? Q, R, S, T.
RST.
Right? P, Q, R, S, T. P, nothing. P, Q, R, S, T. Right? So what is the problem here?
It's getting the ventricular.
There is no ventricular,
Depolarization.
right, there is no ventricular depolarization, right? So what node is not working?
Maybe.
The AV node, right? Because AV node is the connection to the ventricles, and that is being disrupted here, right? So the electricity is not going through ventricles, so you don't have QRS. This is called as a heart block. You may have first degree heart block, second degree heart block, third degree heart block, right? Meaning you're only missing one, right? You may miss two, and then you may have one, right? That's a second degree. You may miss 3 beats and then one, right? So slowly it is now going into stoppage, right? It's going to stop. Pretty soon it's going to go into, it's called as fibrillation, anyway. So you see that, right? Suppose I say that this is missing. The P's are missing. What is not working?
SA node.
SA node.
SA node.
Good. So from EKG you can tell which node is working and which nodes are not working. Alright? So SA node keeps the heartbeat at 72 beats per minute. AV node keeps it at 45. Right? It's much slower. So this is going to result in bradycardia. I'll show you how that looks like. So it may look something like okay, can you see that one? And what is missing? what is not working?
SA
The
node.
SA node, right, and it's much slower. So that's a bradycardia, it's called as junctional rhythm, where SA node starts working, right? So both AV node and SA nodes are pretty important. So look at this one. So you have a P wave, QRS, T, P, nothing, P, and so on, right? So this is what I've shown you, right? So when QRS is missing, that is showing that your AV node is not working. When P waves are missing, that shows that SA node is not working, right? And then this one, there is no rhythm, right? So that's called as heart attack, okay, or a ventricular fibrillation, where it is just fibrillating, right? So the heart is not actually contracting that capacity. Got this? Yes? Okay, don't sleep. So here we have, so that's your ventricular fibrillation. We also have, the heart is connected to external or autonomic nervous system. So that fine tunes, like what sets the pace of the heart?
SA node.
No, SA node, okay. So that is your, what is it made up of? What cells is it?
Pacemaker
It's
cells.
the autonomic cells, right? So it is having its own pace. But is your heart rate always constant? No, right? It goes up and down, right? So, I mean, it is mostly constant, so you have a generalized term. But does it always stay at 72
No.
or whatever your rate is? No. So suppose we have an exam here, what would be your heart rate? Right? So your sympathetic nervous system is on. Suppose you're just relaxing and just about to sleep, what would your heart rate be? Really low, right? So that ups and downs, or you're running from the car to the building, right? So you need more, right, more blood to your organs, so heart rate has to increase. So it is connected to the extrinsic innervation, and that is your sympathetic and parasympathetic, right? So external control. So we have cardio-inhibitory and cardio-excitatory centers in the medulla. So basically, these nerves are coming from medulla. So the purple one here is the parasympathetic, and the green one here is the sympathetic. Right? Parasympathetic is connected to SA node and AV node. That's it. Okay. Sympathetic is connected to all the nodes. Can you see here, 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 right? So that is your sympathetic fibers. Parasympathetic is connected to the SA node and the AV node. Parasympathetic lowers the heart rate, and sympathetic increases the heart rate. At all times, it is under the parasympathetic control, and that we call as, okay, what is that called? Resting in, okay, digestive. That's your vagus nerve, right? And at all times, heart is under the control of vagus nerve. So if we cut the parasympathetic nerves, the heart rate would be 100 beats per minute from SA node, right? But it's always keeps it down, okay? That is called as something tone. We did this in AP1. Vagal tone.
You said that, sympathetic was attached to other ones?
All the nodes. Okay, so heart is under the control of parasympathetic at all times, and that is called as vagal tone. And blood vessels are connected, are under the control of sympathetic at all times. And that is called as vasomotor tone. So you do have connection of both in both, but predominantly heart is under the control of parasympathetic, and predominantly, like under normal conditions, and blood vessels are under the control blood vessels, that's called vasomotor tone, and heart rate is always lower than if parasympathetic nerves were to cut, so that is called as vagatone. And then we have some homeostatic imbalances, like the septum is open, that's called ventricular septal defect. If aorta is connected to pulmonary artery, that's called coarctation of aorta, if it narrows down. And if both sides of the blood is mixed up, that's called tetralogy of valve.
You said for the heart rate, for like raising and decreasing the heart rate, that's parasympathetic or something?
Parasympathetic is going to
Decrease.
Oh, okay.
sympathetic is going to increase. Giselle, you okay?
Yes.
Yeah. Any questions so far? Okay. What is EKG?
Electrical activity.
Electrical activity of the
Heart.
Heart. Good. What is P wave?
Atrial
Atrial
depolarization.
depolarization. What is QRS?
Ventricular depolarization.
Atrial. Contraction follows
Depolarization.
and relaxation follows.
Repolarization.
Alright? Now I'm going to close this down, but let me just quickly go through this. So mechanical activity, so we have two things, electrical activity and mechanical activity, right? So mechanical activity is nothing but physical activity, like flow of blood, right? Or closing of the valves, opening of the valves, contraction, relaxation, right? So all those are mechanical events, right? And they are affected or controlled by the electrical activity, right? So which is like EKG. Okay. So we studied about heartbeat, right? So that is one beat, and then contractions, relaxations, flow of blood, right, from chamber to vessels. All that we call it as cardiac cycle, right? All the events taking place in the heart in one heartbeat or in one cycle is called as cardiac cycle, right? What are these events?
Electrical.
Mechanical and electrical. That's it, right? So they're all in sync with each other. They all cause each other. They have to dance to the tune, all of them. Okay? So that is called as cardiac cycle, right? All the events taking place in the heart within one heartbeat or one cycle, okay, is called as cardiac cycle. You everything okay? So we will talk about the pressure changes, blood flow, and the valve function in just a minute. And connectors. Then we have lub-dub sounds. Lub is closing off.
AV
valves.
valve.
Dub is closing off.
What
What else? Okay. And then we divide the cardiac cycle into 4 phases. I'll come to this. So let me just turn this off. And so you can do that if you want. So I have the electrical activity, I have the lub-dub sounds, I have systole, diastole, right? I need some more terms here, like filling, ventricular filling, ventricular ejection. Then I have 2 other terms, isovolumetric and isovolumetric. Okay. Whenever I use these terms, isovolumetric, think of the heart as completely closed chamber. Okay? All the valves are closed and it is filled with blood, or it has just lost all the blood, right? So we have 2 phases, ventricular filling, right? So ventricles are being filled, they're filled with blood. Just before contraction, they are closed, and that is called as isovolumetric contraction phase. have maximum amount of blood or is it going to have minimum amount of blood? Maximum, right? So it's filling, right? So this will have maximum amount of blood. Alright? And then it starts to contract and you have the ventricular ejection, right? Meaning the blood is going out into the arteries and then the pressure drops and then it is followed by isovolumetric relaxation phase. Okay, so what is happening in isovolumetric? The valves are closed and it's a closed chamber, right? So this will then have maximum or minimum?
Minimum.
Minimum amount of liquid or minimum amount of blood. Alright, so this has the systole, right? And this is going to be diastole, right? Systole means
Contraction.
Diastole means relaxation. So these are the terms we're going to use. Okay. So what is cardiac cycle? All the events,
The events in the heart.
okay, happening in
The heart.
one heartbeat, okay, or 1 cycle. Yeah. So now what are these events? So we are talking about the electrical events, which is EKG, right? So which is atrial depolarization, ventricular depolarization, followed by atrial repolarization and ventricular repolarization. Then we talk about the mechanical activities like contraction and relaxation, right? Filling of the heart, emptying of the heart, right? Opening of the valves, closing of the valves, right? So these are all mechanical events. That put them all together, we have the cardiac cycle. Alright, so and that will answer your questions too. Alright, so I'm going to just talk about it. So listen, and then I'm going to break it down into these 4 parts, and then we'll talk about it again. Alright, so when I showed you the EKG, I showed you like that line, right? When nothing is happening in the heart, that's where I'm going to start. So nothing is happening in the heart, and then blood starts flowing from the veins into the heart passively, right? At right atria, right, the inferior and superior vena cava, the pressure is 0, right? So the veins are going to be squeezed by the skeletal muscles to bring the blood back. So blood is just passively flowing, okay? The AV valves are open at that time. AV valves are open, semilunar valves are closed, all right? AV valves are open, it's flowing passively, SA node fires, SA node depolarizes the atria, right? About 70% of the blood already goes into the ventricles, then the atria gets depolarized and starts to contract, right? So it's going to contract all the blood that is in the atria into the ventricles. By that time, it has already reached the AV node, the electrical activity, then it goes down, right, into the ventricles. It innervates the papillary muscles. Papillary muscles are going to contract, and that's going to close the valve, right? So now we have both the AV valves and the semilunar valves closed, right? So the ventricles are now in the isovolumetric contraction phase. They're filled with blood, right? The whole ventricles, they're getting depolarized. Following the depolarization, they're going to contract, right? So the pressure is increasing. As the pressure increases, you have the pulmonary artery, which has 24/8 mmHg, aorta, which has 120/80. Once it overcomes that 80 and 8, the semilunar valves open. It's just pushing, right? So think of like a balloon filled with water and you're squeezing it, right? If there's a little hole, it's going to come out of that. That's exactly what is happening. The pressure is building up. As the pressure builds up, it's going to open up the semilunar valves and go into the arteries, right? It is going to go through the arteries till you have the pressure, right? So once the ventricles get repolarized and they start to relax, what is going to happen to the pressure? It's going to go down, right? The pressure is going to relax. The blood, as it is going up, it's going to come back, close the valves, and then you have the ventricles again, a closed chamber, and then the whole cycle starts again. All right, that's your cardiac cycle. Now you ask your question.
I'll let you guys one thing. So So when the atrium contracts, it's just making sure all the blood is out of it, so it's completely empty, right? Okay.
The blood was already
flowing into the ventricles, into the ventricles, right? It's going into the ventricles.
So when it contracts it, like,
Atria is contracting, it's not about atrial contraction.
yeah.
Atria is contracting to push the blood into the ventricles. What was your initial question? Something about valves and EKG?
That was it actually, because at the same time of it contracting is when the AV valve closes, right? Like, so when the atrium contracts, the valve closes
No.
right after, no?
No. When will it close?
It will close before.
Before the ventricles contract. Right. It will close before the ventricles contract.
Because then it will
Not
cause
when
blood
atria is
into the
contracting.
atria.
That has nothing to do with the valves.
Oh, okay, I see. So,
Nothing to do with the valves. So the valves are closing because papillary muscles are contracting. And that pushes, tugs on the caudate tendon, which closes the valves.
okay, oh, okay, I see.
Did I answer your question?
Yeah, no,
I was
it's-
like, I couldn't answer at that time because I have to go through this whole thing to explain.
Yeah, no, it makes sense, yeah.
Any questions? Okay, I'll give you 2 minutes. Get up and shake yourselves. I don't want you guys sleeping. Because this is really important. You have to understand.
So whenever the, all the ventricles contract, the papillary muscles first start to contract. When the papillary muscles contract, the AV valves close.
It's this stuff right here, the isolated
Yes. So before the contraction can
Contraction of the
actually
ventricle?
happen, you need to close the valve so it doesn't backtrack into the atrium.
which happens because the papillary muscles.
Yes. Papillary muscles contract first, AV valve close, then ventricular muscle goes. Here you go.
Now, how do I write that? Really, how do I write that into my picture? Okay.
I think I wrote it here. Here you go. When AV node sends electrical signals to ventricles, the papillary muscles start to contract first and pulls on the chordate, the vertebral cord, and closes the AV valves. Those close, and the whole ventricle contracts.
Cycle. You need some more time to test it?
Hmm?
It's so funny to see you guys smiling and typing. I've taken pictures of students all on their phones, texting and smiling. So cardiac cycle is, we break it down into four steps. So we have ventricular filling, then volumetric contraction phase, and then ventricular ejection, and isovolumetric relaxation phase. Okay, so at the beginning, when the SA node is firing, atria is about to get depolarized, blood is coming right through the veins, passively flowing through the open AV valves into the ventricles, right? After the atria gets depolarized, they will squeeze all the blood into the ventricles, right? AV valve is not closed yet, right? So, from an SA node, it has come to the AV node, stopped, atria is contracting, then it boom, it goes down, right? So as it is going down, the bundle branches, it's going to depolarize the papillary muscles, which are going to contract before the ventricles contract. As papillary muscles contract, they're going to close the AV valve, all right? So that's what closes the AV valve. now we have isovolumetric contraction phase, right, where you have the ventricles completely closed chambers and it has the maximum amount of blood, right, which is called as end diastolic volume. Okay. So what is this? This is the volume, right? Amount of blood, which is about 120 milliliters. Alright? So it's also called as EDV. Maximum amount of blood just before it contracts. Right? So by this time, AV valve is closed, the ventricles have been depolarized. Following ventricular depolarization, what's going to happen?
Contraction.
Ventricular contraction, right? So the ventricles start to contract, that's what this is, right? So ventricular systole begins, which closes the AV valve. So AV valve closing is because of the papillary muscles, right? Before the ventricles close. So once the ventricular systole begins, the pressure builds up, right? And atrial diastole begins. We don't care about what is happening in the atria anymore, right? So now they're going to relax. So that's what this is saying. Atrial diastole begins, right? Meaning atria is going to relaxation mode. Semilunar valves are still closed. So all the valves are closed, right? Isovolumetric means all the valves are closed, right? Semilunar valves is closed from the previous cycle. Does that make sense? Okay. So we want the AV valves to be closed here at this time. So if I put this one here, so you can see that on both sides, blood is entering, right, through the veins, and as they're entering, they're filling it up, the valves are still open, right? So that's your ventricular filling, right? By this time, SA node has reached the AV node, okay? Atria is contracting, coming down, it has reached the papillary muscles, the papillary muscles closing the valves, right? That's your first sound, dub sound. I'm sorry, love sound, love dub, right? Love sound. And you have, these are filled with blood, maximum amount of blood, that is called as end diastolic volume. Are we good till here? Yes. Then we go, so you have ventricular systole begins, AV valve is closed, okay, due to the papillary muscles. Semilunar valves are closed. You have, don't worry about that, you have end diastolic volume. Yes? Okay. Any questions so far? I'm going to ask you guys to write it on your own. Okay? And this is oversimplified. I want you guys to write down SA node has fired, atria is depolarized, atria contacts, all that. Okay, so that I'm leaving it up to you. And then it comes to the AV node, then it innervates or it depolarizes papillary muscles before the ventricles. Papillary muscles are contracted, closing the AV valve. I need to see that, all right? So what causes the AV valves to close? Papillary
Contraction.
muscles, right? Contraction of papillary muscles before the ventricles contract, okay? That is not given in the figures, you have to write it. Okay, don't forget to write that. All right, so once the ventricles contract, what's happening to the pressure? Oh, no, that's my drawing, okay. Once the, I said that is really good drawing, okay. So once the ventricles start to contract, what happens to the pressure? Pressure is going to rise, right? The ventricular pressure increases. Now let's see what's happening. So here you have the pressure is increasing. So when the pressure increases, it is going to open up these valves. Can it open this valve? No, because they are still attached to the papillary muscles. The papillary muscles are still contracting, so this cannot open, and we don't want them to open, right? If they open, this is going to go back into the atria. We cannot have that, right? So this is going to push open these valves, and it's going to go up. This is going to remain open as long as the pressure here is higher than the pressure here. Okay? So what is the pressure in pulmonary artery?